Minister of Health, Dr. Osagie Ehanire, believes that an increasing number of people are dying as a result of not being given attention by hospitals, who themselves are scared of taking in COVID-19 cases. According to him, this situation has been a major source of complication in the battle to flatten the curve of the pandemic, which yesterday claimed the highest number of fatalities in a single day. Added to the minister's apprehension is the incidence of hospitals, particularly privately owned ones, that refuse to treat COVID-19 cases and which also do not declare fatalities for fear of being sanctioned. How can this situation be resolved in order to enhance the fight against COVID-19 and prevent undue pressure on the country's healthcare system? We're about to seek answers to these questions and more from Dr. Francis Faduyile, President of the Nigerian Medical Association, who has been on this program before and who is also here and whose tenure will soon be ending as President of the NMA. What will you be recommending, Dr. Francis Faduyile? Good morning. Thank you for joining us on the morning show again.
Good morning, Dr. Faduyile.
Good morning. It's my pleasure being here. Thank you for inviting me to come and make this discussion today.
On May 4, the Minister of Health, Osagie Ehanire, pointed out that private hospitals were no longer treating COVID-19 patients or even patients that presented with other cases, and that this has been resulting in the number of fatalities and statistics. Now, yesterday, that same point was repeated by the chairman of the Presidential Task Force on COVID-19, Boss Mustafa, and he not only expressed concern, he advised that owners of private facilities should not turn people away because of COVID-19. The last time you were on this program, you had touched a bit on this particular issue. But what exactly is the problem? Is it that there has been no enough collaboration within the task force or the federal government and owners of private hospitals, as we were told at a point in the course of the management of this pandemic?
Thank you very much, Ruben. I must tell you, it's not that there is no enough collaboration. The truth is that there is no collaboration at all. The government has consistently seen the private health practitioners as competitors. And we have told them when we started that as you are planning to take care of people or doctors and health workers in the private and public institutions, you must also extend that to the private health facilities. We gave them statistics that over 60% of Nigerians patronize the private health facilities, and if you do not take care of those who are working there, then you put a lot of pressure on the public health facilities. Even the public health facilities that we have, the government has been suboptimal in ensuring that we have enough PPEs and other medical consumables available for them. There is nothing that they have done for these private health practitioners. And it is really unfortunate, because when we have a case like this, it is expected that every constituent part of the health system is involved. But this case is not what we are seeing in Nigeria, and that is why we are having this. I can just tell you authoritatively, just last night, I had an SOS in Lagos where there was a young accountant who died in Mushin area because he had cases, he had a case that looked like COVID-19. The private health institution could not afford to admit. They tried to get to the number that was given, and nobody came to his aid up to 5 days, 6 days, until he gave up the ghost yesterday. These are the issues that we are facing day in, day out. And we need to move from just giving order, giving directive, and not following it, following them, at the executive level. And this is a very big problem for Nigeria and Nigerians.
Certainly it is, Dr. Faduyile. It's a very serious problem, and private healthcare facilities are being put in a very peculiar position right now. So I wanted to ask you, in terms of support for private healthcare facilities, and I'm saying this given the fact that if we're looking at our current trend of COVID-19 in the country, we already know that numbers are going to go up. And like you said, 60% or over of Nigerians depend on private healthcare, which means that inevitably private healthcare is always going to be in the mix here. What support do private healthcare facilities really and truly need right now from the federal government that private facilities are not getting?
Well, for any hospital or health facility to be able to see any patient, I mean any patient, COVID-19 or non-COVID-19 positive patient, those health workers in those places must be well protected. Personal protective equipment must be in place for them to be able to see patients, because every patient is a potential COVID-19 positive patient. If you do not have that, then it means that you are exposing your workers to being infected. Secondly, it is also important for the government to see that the private institutions that hitherto had a case of COVID-19 positive is not unnecessarily locked down. They should find a way so that they can continue giving their services. We have had cases where private health facilities had one or two cases of COVID inadvertently in their hospitals, and what the response that they have gotten was that they closed down that place for 2 weeks because of a contamination. And how many private, and there is no any form of support that will be given to them. So every private institution who depends solely on the patients that they see, on the day-to-day activities that they apply, who needed to pay his workforce, must be double sure that he doesn't bring in any COVID-19. And these are the dilemma that we have faced. We need to support the private hospitals, number one, for them to be able to have a rapid diagnostic kit. It is the game changer that we have to employ now, because by the time you have this rapid diagnostic kit, which is a preliminary test, you can know the patient you want to admit after the triad and continue to treat. But if we continue to hold on and wait for this molecular testing that takes weeks before the result comes, we will continue to be in this particular pathway for a fairly long time to come. And like you have said, it is not only COVID-19 patients that are affected. Ordinary patients who has other ailments will have it difficult for them to be treated by the private hospital. Something happened in Abuja just yesterday again. There was a woman who had medical emergency very late in the night. He went to his neighbor's house, knocked the door, and she continued knocking, and nobody could open because they don't know the type of ailment she has. She passed on before the dawn. And these are stories that we hear everywhere, every day. Is it the lockdown that we want to say when you have emergency and they lock you down, they do not allow any vehicle? There is no way that we are trying to triage and know who has a right passage at any given time. You are just doing it as if there is no reason for you to segregate people. And these are the problems that we are facing. We need to wake up from our slumber and take active role in containing and controlling and managing this COVID-19 and other diseases in this country.
Well, Dr. Faduyile, you need to help us clarify something. I recall that in April, the federal government, the task force, had said that, look, certain private hospitals should stop treating COVID-19 patients. And that caused some panic. And later, that was reviewed, and we were told that the task force, or the Federal Ministry of Health, was going to identify certain private hospitals across the country that have the facilities, that have perhaps the personnel, and by their assessment could treat COVID-19 patients. Now, where are we with that? Because yesterday at the briefing, the chairman of the task force also pointed out that the Minister of Health has been talking to medical directors and that a solution was being worked out. Now, as the task force talked to any hospital, are there private hospitals that have been designated? And is it true that the minister has been engaging medical directors and the NMA in any kind of a conversation? But let's take a quick commercial break now. When we return, we'll take your response to that question. We'll be right back. It's still the morning show here on Arise News. Welcome back to the morning show here on Arise News. Still with us is Dr. Francis Faduyile, President of the Nigerian Medical Association. Dr. Faduyile, before we went on break, I'd asked you a question about how far the federal government has gone in designating certain private hospitals as ICU centers or treatment centers for COVID-19, whether there has been any progress in that regard.
Well, thank you. It is not about the designation of private hospitals for treatment of COVID-19 that is the main problem that we are facing. The main problem that we are facing is the hospital that are seeing the patients that are not yet tested and they may be COVID-19 positive. It is when you admit such patient and you are in the course of treating other ailments that you will now discover that they are COVID-19 positive. And the only way to take care of that is if we introduce rapid diagnostic testing in Nigeria. In Zimbabwe, I'm very positive, and for a fact, they have incorporated rapid diagnostic tests. You see, the fact is that once you have a COVID-19 positive patient, because it is highly contagious, many or most of our private health facilities cannot take care of them. They will need to refer them to where they needed, they had the necessary biosafety and biosecurity measures to treat them. But the main problem is people who had come for another ailment and they are COVID-19. And it is the weakest link that we have consistently told the government that you must provide adequate security for health workforce irrespective of where they are working, irrespective of the presentation of that patient coming in. Because it can be a COVID-19 patient, it can infect the health workers, other patients, as well as the workers within the hospital. These are areas that we are looking into. Yes, the federal government may be discussing with some medical directors or some other group of people, but all I see is if we are still discussing at week 12 or week 10 of the importation of COVID-19 in Nigeria, it means we are lagging behind in our containment effort or mitigating effort towards containing this COVID-19. And I think the government needs to take this passive activity towards containing it and be proactive. We need to determine programs that we are looking and we are working assiduously to flatten the curve and change the tide. What we have been seeing largely is for us to say we are following the disease, we are doing this, we are doing that. We are still lagging behind in the total number of tests that we have given to Nigerians. And despite this, we are continuing to ease the lockdown, allowing people to intermingle, which will certainly increase the infection of Nigerians with COVID-19.
Dr. Faduyile, thank you. Just very quickly on the point that you made about rapid test kits. Part of the worry that we are hearing is that a lot of rapid test kits are producing false positives or false negatives. Would you like to comment on that? But more so, you brought up the lockdown, and this is what I want us to take up with you, because on Monday we're set to hear from the Presidential Task Force again with regards to the next phase of the easing of the lockdown. Now, 2 weeks ago, what they did was they left phase 1 as it was. So now we're wondering what is going to happen with the next phase. What advice do you have for the federal government, the Presidential Task Force in particular, with regards to next steps that they should take or announce to us on Monday?
Thank you very much. Let me first answer the rapid diagnostic tests. Yes, it is not confirmatory. And in every scientific test, it is acceptable you have a preliminary test and confirmatory test. We are having problem with the molecular testing, which is the confirmatory testing. It takes weeks. A patient comes to your hospital, you want to know the status of that patient, and you have to wait for 5 days, 6 days, that patient is dead. And we keep complaining about logistics. Are we not thinking of the life of Nigerians that are lost daily? We must change the tactics. We cannot continue in this snail speed of trying to contain this COVID-19. Rapid diagnostic test, either it is having low specificity or sensitivity, it can give you something to work with at that point. We take that, we have it, we treat. Then if you have those who are positive, you send them for confirmatory tests, which will take off the plug of large number of people coming to have these tests, and we have some of them that are negative. Why can't we do research on 1 or 2 of these rapid diagnostic tests and see the one that gives us fairly high specificity or sensitivity? Even our molecular testing is not foolproof. So why are we talking as if we have all that we can use to take care of ourselves? Nigerians are dying. We need to halt it. People are infected daily. It is until we take proactive steps that we can actually change the tide of things. So we need to look into that, research into that, and change tactics. That is on that one. On the second question that you have asked, if you have followed the rate of infection, some few days ago, we just hit, I think, 7,000. And within 3 days, 4 days, we are adding 1,000 each. When we eased the lockdown on 2nd of May, we were 2,388 Nigerians who are confirmed positive. Today, we are approaching 10,000. Are we getting the required, is our mitigating response getting the required effect that we needed? What different thing are we doing to contain this infection? We are not doing anything different. We are working, we are looking at the infection just going around, and they should give us specific things that they are doing differently that we know is aimed at stopping this COVID-19 infection. Well, I think Faduyile, we need to change the tactics.
Dr. Faduyile, quickly before we go, your tenure as president of the Nigerian Medical Association will soon be coming to an end. And I understand that you are looking at running for governor in your state, Ondo State. You tried to run for office in 2011, now again in 2015, and now 2020, I understand you want to be governor. How optimistic are you that you'll be able to displace the incumbent governor of Ondo State? And is there truth to the fact that this is the next path for you?
Yes, thank you very much. It is the next part, that is true. And I can tell you that people in my state, Ondo State, are yearning for that change. We have seen a government that have been in place that have not achieved much to their yearning. And we need to change the landscape of things. Ondo State is supposed to be one of the richest states in the southwestern states. It's one of the oil-producing states. We have a lot of mineral resources. We have a lot of educational institutions that can improve science and technology. We have a lot of cash crops, cocoa, kola nut. Cocoa is the main export of Ghana, and they are doing very well. We have petroleum, we have bitumen. We need to harness it. And I can tell you that people in our states are yearning for that change, and the change that they are looking for is in yours sincerely, Dr. Francis Faduyile, which I believe at the appropriate time will get that.
Well, we wish you all the best with your political ambition. And I think that on that note, we would like to thank you very much for joining us this morning on The Morning Show.
Thank you very much, Dr. Faduyile.